Okay, it should be going. Honestly, I'll just be like, sorry, Whitney, if this is on. Okay. Hi, I'm Anastasia. I'm a PA student with JMU. I'm just helping out with your appointment today. Can I have you confirm your name and date of birth for me?
Maggie Sobel, July 7th, 2001.
Perfect. And is Maggie the name you'd like me to use for the remainder of the appointment? Perfect. And do you have any preferred pronouns?
She, her.
Okay. And is there anything that I can do to make you feel more comfortable today? Is it all right if I take a seat?
Yeah.
Okay, perfect. So it sounds like you're coming in today for a comprehensive exam. Does that sound about right? Okay. Are you ready to get started?
Yeah.
So what brings you in today?
My knee's been hurting me.
Okay, and is it your right knee that's been hurting you?
My right knee.
Okay, how long has that been going on?
About like happened about a week ago.
Okay, and do you remember any like trauma to the area, or did it just kind of start happening?
Yeah, I was playing soccer and I just twisted wrong.
Okay. Right. And you said that it was about a week ago. Has the pain gotten worse? Has it gotten better at all?
It's kind of stayed the same, so that's why I wanted to come in.
Okay, sure, it makes sense. And can you describe the pain for me?
It was sharp at the time, but now it's just kind of dull and annoying.
Okay, and how would you rate your pain on like a scale of 0 to 10? 0 being no pain at all, 10 being the worst pain you've ever felt in your life.
Now probably like a 5 out of 10.
Rather 5 out of 10, and it stayed kind of consistently at that 5.
Yeah.
Okay, awesome. And have you tried anything that's made it better?
I took some ibuprofen. And that helped a little bit.
Okay. And how often are you taking that ibuprofen?
Just the recommended amount.
Have you done anything that makes it worse? I know you mentioned it happened during soccer. Does walking make it worse or anything like that?
Yeah, walking makes it worse.
Okay.
And playing soccer.
And playing soccer. Have you tried to go back out on the field and play soccer since the injury?
Yeah, it's just been hurting. So I stopped.
So that's probably like affecting your everyday life because you're not able to play soccer. Are there any other ways that it's affecting your life?
Really, it's just annoyance when I'm walking and stuff like that.
Okay. And are you having any like radiating pain, or is it really just staying right in that knee area? Are there any things that I didn't touch upon that you think is important for me to know about your knee pain or any other concerns that you have going on today? Yeah. Alrighty. So what I've heard is that you've been having right knee pain for about a week. It happened while you're playing soccer. It's been kind of affecting your life because you're not able to play soccer anymore without the pain coming back, and walking around is a little hard. But Aleve has been helping. It's been staying at that about like a pain level of a 5. And you're just coming in to get it checked out by us because it hasn't really gotten worse, but it hasn't really gotten any better. Does that sound about right?
Yeah.
Okay, perfect. So I'll definitely keep all of that in mind and report that back to my supervising physician. But because this is a comprehensive exam, I do have a couple other questions to ask of you today, if that's all right. Okay, perfect. So first, we're just going to kind of talk about your medical history. So we will start out with, do you have any allergies?
I'm allergic to kiwi.
You're allergic to kiwi. Do you know your reaction to kiwi?
Sometimes.
Sometimes. Okay. Do you have any allergies to any medications?
Nothing.
Okay. And are you taking any medications at the moment?
Birth control.
Control. And what kind of birth control are you taking? Okay, perfect. Is that just an oral contraceptive you're taking every day? Okay, perfect. And have you had any major injuries other than this right knee pain that you've been having with soccer, but any other major injuries that you've had?
I was in a car crash about 2 years ago. I just got a concussion from it.
Just a concussion. Did you get a full workup at the hospital? Okay, perfect. And did you have any overnight hospital stays?
No.
Yeah, okay. Have you had any blood transfusions? Are you up to date on all of your immunizations?
Yep.
Okay, perfect. Are you up to date on all of your screenings, kind of like your pap smears or anything like that?
Yep.
Okay, perfect. Do you do any self exams, like a breast exam at home?
No.
No? Okay. Do you, so no self exams, all up to date on all of your screenings. Do you go get your physical once a year as well?
Yeah.
Have you had any childhood illnesses that you're aware of? No? Okay. Have you been diagnosed with anything, like any medical conditions as an adult?
No.
No. Have you been diagnosed with any psychiatric conditions as an adult?
Anxiety.
Anxiety, okay. And you don't take any medication for that?
Not at the moment.
Not at the moment. Alrighty, now we're gonna kind of move on to a little bit more about yourself gynecologically. If any of these questions make you feel uncomfortable, just let me know and we can definitely move on. How old were you when you first got your period?
Well,
Okay. And how often do you normally have your period? Like how long are your cycles usually? Every month? Okay. Perfect. And how long do your periods usually last?
5 to 7 days.
5 to 7 days. And how would you describe your period? Do you have any symptoms with your period, like any cramping or
Yeah, some cramping.
just a couple cramps? Okay. And how would you describe your flow?
Regular.
Regular. Do you have any new changes to your period?
No.
Any concerns that you have in your period? And have you ever been pregnant? And have you had any STD or sexually transmitted disease screenings?
No.
Are you open to getting some testing done today? Okay, perfect. We can definitely chat about that later. And then
I get lunch, on the job a lot.
okay, and now we're just gonna move on to family history. So when I ask these questions, I'm speaking directly about biological family members. If you have any questions about the questions that I'm presenting you, or if you don't exactly know the answer, that's totally fine. We can just move on and answer it to the best of your ability. So first we'll start with mom. Is she still alive?
Yes.
And how old is she?
53.
And has she been diagnosed with any medical condition? And how about your mom's mom? Maternal grandparents? She's still alive.
She also has hypolipidemia.
And how old is she?
83.
And how about your mom's dad, your maternal grandfather? Is he still alive?
Yeah.
And how old is he?
74.
And does he have any medical conditions?
He had a heart attack about 5 years ago.
Okay. Is he on any medications for that? Do they kind of okay. And then now we're gonna move on to dad. Is dad still alive?
Yep.
Okay. And how old is he?
52.
Does he have any medical conditions?
Hypertension.
And now we're gonna move on to your dad's mom, your paternal grandmother. Is she still alive?
No, she's dead.
Okay, and when did she pass?
3 years ago.
Okay, and do you know the cause of her passing?
Sure.
I'm sorry. And what about your paternal grandfather? Your dad's dad. Is he still alive? And how old is he? And has he been diagnosed with any medical conditions?
No.
And do you have any siblings?
Yeah.
How many siblings do you have?
One brother.
One brother. Are they older or younger? How old are they?
91.
And have they been diagnosed with any medical conditions? Okay. Awesome. So that's everything that I have for family history. Is there anything that I didn't really touch upon that you think is important for me to know?
No.
Awesome. Then we're gonna move on to social history, just kind of learning more about yourself. So how would you describe your overall general health?
Healthy. Exercise regularly.
Awesome. And how would you describe your overall typical day?
I am a college student, so I wake up in the morning and I go to class, and then I go back and I study. And then, sometimes on the weekends go party.
Awesome. Sounds like a good work-life balance. And you mentioned that you're still in school. I was gonna ask the highest level of education that you've completed, if you feel comfortable with that.
Yeah, currently getting my college degree.
And college can be stressful. How would you feel your overall stress level is on a daily basis?
It's really stressful during exam weeks, finals week especially. Other than that, pretty well.
Good. And you think that you're managing that stress during that period pretty well?
Yeah.
Okay, awesome. And do you feel satisfied with school?
So when you
And now I just have a couple extra questions about yourself. I know that you mentioned that you exercise. How often do you exercise?
like twice a week.
And what kind of exercises do you usually do?
Well, I was playing soccer, but I don't know, 10 years, so.
That totally makes sense, and we'll definitely chat with my supervising physician about that. Hopefully we can get you out on the field sometime soon. That is such a bummer. Sorry about that. And kind of going off of that, are you eating healthy? What does a normal diet look like for you?
Oh, so fruits and veggies, vegetarian, so.
Nice. And what about caffeine intake? Do you have a lot of caffeine? I know college students usually drink a lot of coffee.
Yeah, you know, a couple days.
Okay, awesome. And do you think that's affecting your sleep at all, or how would you say your sleep is?
Great.
Your sleep's good? Okay, how would you describe your like overall sleep schedule or pattern?
Try to get solid 8 hours.
Okay, awesome. That's great. And then college students do have breaks. So have you been traveling recently?
Oh, I wish, but no.
No, not within the past year at all. Okay. Well, hopefully after this knee gets fixed up and you have a good spring break, we can get you traveling again. And then do you have, how would you describe your living situation at the moment?
Yeah, I have a roommate and it's going pretty well.
Okay, awesome. Do you have a partner?
Yeah.
It's anxious
Yes,
sometimes.
I do.
I think just work stress.
Okay, perfect. Yes.
Yeah.
Awesome. And do you feel safe in your relationship?
Yeah.
And do you feel supported? Do you feel as though you have a good support system at home?
Yeah.
Okay, awesome. And I know that we already chatted that you're in school, but where were you born?
I was born in Virginia.
Okay. And are you going to school in Virginia? Are you far from home, close to
I go
home?
to school in Virginia.
Oh, awesome. Perfect. How far from home are you? Do you get home?
About 2 hours.
Awesome. That's great. Sorry, I got a little lost. Do you have any hobbies? I know that you mentioned soccer, and I know that that probably takes up a bunch of your time, but any other hobbies that you have?
Like to hike, I don't know, for skiing.
Do you wear a seatbelt when you're in the car?
Yes.
Yeah. Do you wear a seatbelt when you're the driver and the passenger? Okay. And if you were to ride a bike, I don't know if you ride bikes or not, but would you wear a helmet?
Yes.
And do you have a smoke detector in your apartment?
I believe so.
Okay.
Sometimes.
Okay, perfect. Awesome. Just make sure the batteries are all reset in that. And do you come into contact with any like hazardous materials during the day? I don't know what kind of major you are in college. No. Okay. And I think that's all that I have for the first part of our social history. Now we are going to kind of go into a little bit more serious topics for social history. So if any of these make you feel uncomfortable, again, just please let me know and we can definitely move on. Do you use any tobacco products?
No, only from.
Do you drink any alcohol? I noted
Yes.
you mentioned like partying on the weekends a little bit. Okay, how often are you drinking?
I'm a college student, so I drink about like 5 to 7 drinks on the weekend.
Is
But
that
not during the week.
not during the week? Is that usually like spread out throughout the weekend, 4 to 7 drinks, or 4 to 7 drinks each time that you're drinking?
Per night.
Alrighty. Do you usually feel safe while you're drinking? Do you have a good support system with friends? Okay. And then, do you use any recreational drugs? No. Okay. Have you ever used any recreational drugs? For now, we're gonna go on to sexual history. I know that you mentioned that you do have a partner. Do you just have one current partner?
Yes.
Okay. And how many partners have you had over your lifetime?
Just 2.
Okay. And are you sexually active with your partner?
Yes.
Okay. And what kind of sexual activities do you usually engage with your partner?
Can you give an example?
Yeah, definitely. So, usually the main three are vaginal, oral, and.
Oh, yeah, for sure.
Okay, just vaginal.
Okay. And how would you describe your sexual orientation? And I know earlier we talked about STDs and contraception. So just to reiterate and kind of like summarize it, you haven't had STD testing before, but you're open to chatting about possibly getting some today. You are on an oral contraception. Are you using any protection when you are having?
Yes.
Yes. Okay. And do you feel safe in your relationships? We talked about that earlier. Do you feel satisfied in your relationship? Okay. And do you feel satisfied with your sexual health? Awesome. And now we are going to move on to what we call a review of systems. I'm basically gonna just ask a couple questions about different parts of your body. Feel free to elaborate as much as you'd like. But you can also just kind of say yes or no, whatever makes you feel the most comfortable. So first we're gonna start with kind of like a general overall. Have you noticed any changes in weight?
Oh, no.
No, any fatigue?
I mean, sometimes I get really tired as a college student.
That totally makes sense, but nothing more than normal for you. Okay, and any fevers? And now we're gonna move on to your skin, hair, and nails. Have you noticed any rashes?
No.
Any changes in your skin, hair, or nails?
No.
Or any like lumps or bumps? Now we're gonna move on to your eyes. Have you noticed any vision changes?
Oh, no.
Any kind of on the same scope as that for any blurred vision?
Maybe sometimes when I'm in class, I have to like squint a little bit more, but nothing too bad.
Okay, and how long has it been since you've gone to see like an eye doctor?
I've never gone to an eye doctor.
Okay, well, maybe we can chat about possibly getting you a referral to go see an eye doctor. Have you noticed any eye pain? Okay. Now we're gonna move on to like your nose and sinuses. Have you noticed any congestion?
I had a cold like a couple weeks ago, so but it's kind of cleared up
Okay.
now.
Perfect. So no congestion at the moment, and when you had that cold, it was a little out of the ordinary. Okay. Have you noticed any like nosebleeds, any recurring nosebleeds, or any sinus pain? Okay. And now we'll move on to your ears. Have you noticed any ringing in your ears? Any loss of hearing? Or any earaches?
I appreciate it.
And now we're gonna move on to your mouth and throat. Have you noticed any bleeding gums or any dry mouth? Okay. And now we're gonna move on to like your head. Have you noticed any headaches? Have you lost consciousness or any kind of falling? Okay. Any dizziness? Now we're gonna move on to your neck. Have you noticed any lumps in your neck? Any soreness
No.
or any stiffness with your neck? You can't really move it around.
No.
Okay. And now we're gonna move on to your breasts. Have you noticed any lumps in your breasts?
No.
Any soreness or any nipple discharge? Okay. And now we're gonna move on to your lungs. Have you noticed any coughing?
No.
I know that you mentioned that you were kind of sick recently. Was coughing kind of involved in that?
It was. It's gone now.
Okay, perfect. And if you were to kind of cough, do you ever notice that you're coughing up any blood?
No.
And do you ever feel like you're gasping for air? Okay. And now we're gonna move on to your heart. Do you ever feel as though your heart is racing out of your chest and you can't control it? No? Okay. Have you noticed any kind of like swelling in your legs or your arms at all?
My knee got a little swollen after the injury.
But only after the injury, not like on a daily basis at all? No? Okay. Perfect. And then have you noticed any pains, like any chest pain?
No.
Now we're gonna move on to kind of like your GI area, your stomach. Have you noticed any diarrhea, any vomiting, or any blood in your stools when you go to the bathroom? No. Okay. And then have you noticed any
You're very like
pain when you're urinating? No. Any burning with urination? Any increased urination, like you feel like you are going to the bathroom all the time? Or any blood in your
Yeah.
Okay, and now we're gonna move on to kind of like your genital area. Have you noticed any sores, any lumps, or any abnormal discharge? No.
Get better with.
And now we're gonna move on to your kind of like your muscles and your joints. Have you noticed any stiffness? No. Have you noticed any swelling or any redness? No. And now what we call is peripheral vasculature is just kind of like all the blood vessels in your body. So I'm gonna ask about like leg cramps. Do you have any leg cramps that you've noticed? I know you say that you play soccer, but it's kind of like a really strong leg cramp that you'd have. No? Okay. Have you noticed any veins that are kind of standing out that you can see from the surface? No, or any wounds that you have that kind of are really slow to heal?
No.
Okay. Have you noticed that you bruise easily? No. Would you say that if you got cut that you would bleed more than you're a friend of yours?
So
No. Okay. And we do have these like little lymph nodes and glands in our body that sometimes swell up. Sometimes they swell up when we are sick. And I know that you said that you were recently sick. We have some in our necks, some kind of like in our armpits are the main ones that people usually notice. Have you noticed any large or swollen glands in those areas?
no, like you were saying like a couple weeks ago, I noticed that in my neck, but now it's not. That's not
Okay, perfect. So like no swelling, no pain in those areas. Okay, awesome. Good to hear. I'm glad there's kind of already fixed itself. And now I'm going to ask if you, so I know that you said you've been diagnosed with anxiety, but recently have you been feeling any increase in anxiousness?
And when I have an exam coming up.
But not on a regular basis, no like worrying that you feel like you can't control. And what about, have you been feeling depressed at all? Or any extreme mood changes?
Yeah.
Is he really like,
Just while we're here, do you have any other like questions? So, like, not even about this, but
I guess, I feel like that is probably all that I have for you. Do you have any additional questions for me that I didn't ask you that you think is important for me to know, or anything that you want to bring up today? Okay, perfect. Well, it was so nice to meet you. I'll go chat with my supervising physician, and then we'll come back in to discuss the moving forward with your knee pain. Okay, it was nice to meet you.
Me too.
I just came up with like 3 that I missed, but that's okay. Thank you for doing this with me.